Hi, this is our verbal presentation for Psychology and Lifespan Development. My name is Sarah Young and my ID number is 1081836 and I'm doing a Bachelor of Health Science and I'm endorsed.
Hi, I'm Angeline Hennessy. My ID number is 0945328 and I'm doing the Bachelor of Health Science non-endorsed.
Hi, my name is Jessica Johnston and my ID number is 1077418. I'm doing the Bachelor of Health Science majoring in physiotherapy, and physiotherapy will be the health profession to which we will be applying the intervention skills.
John Heron explains that when dealing with a client there are two categories of intervention.
The authoritative, an example of which is informative intervention, helps to direct behaviour.
The facilitative, an example of which is supportive intervention, is concerned with encouraging the client to take responsibility for him or herself.
Supportive intervention seeks to affirm the value of the client's attitudes and actions. It encourages clients to take more responsibility for themselves because they are given a healthy outlet to their feelings and feel that they are being heard. It is important for a young adult in the intimacy versus isolation stage to know that they are being listened to with empathy because according to Mofu, openness is important in establishing relationships. A physiotherapist who demonstrates supportive intervention provides an environment in which clients can express themselves without a fear of being rejected.
For example, a young netball player may be frustrated about an ankle injury preventing her from participating in her sport. If a physiotherapist listens to her with empathy, the young athlete's attitude may be changed, and this will enable her to better cope with her situation. The following role play demonstrates this example using the supportive intervention appropriately.
I'm so frustrated by this. I'm not going to be able to play netball for a while.
I can see that you must be frustrated about not being able to play netball, but in order for us to get you back to your full potential when you do return to play, it's important that we manage this injury appropriately. If you ever have any concerns regarding the injury or the rehabilitation, I'm here to talk to.
The following role play demonstrates the same situation, but the physiotherapist is not demonstrating supportive intervention correctly.
I'm so frustrated by this. I'm not going to be able to play netball for a while.
Yes, I'd be frustrated too if I couldn't play netball for a while. But if you don't do the physio treatment, you'll probably just end up doing the same injury later on, and then you'd be in an even worse situation. So it's best you just harden up and do the exercises. You'll get there in the end. Supportive intervention is also a beneficial means of ensuring that a client in late adulthood feels affirmed. For a physiotherapist to express concern about an elderly client's well-being implies that support is available and is a way of encouraging the client to take care of him or herself. Support can also be expressed by appropriate physical contact. For example, when dealing with an elderly stroke victim who is feeling upset, it would be appropriate for a physiotherapist to place a hand on his or her shoulder.
It is important to use supportive intervention in an ethically appropriate manner, and this can be ensured by adhering to the Code of Health and Disability Services consumer rights. Some of these rights include being treated with respect and to be free from discrimination, harassment, and exploitation. John Heron comments on how using physical touch to portray support is sometimes not used for fear of possible sexual implications. As a physiotherapist or other health professional, it is important to make it clear that the physical touch is respectful and cannot be perceived as harassment or exploitation. Consumers of a health service also have the right to dignity and independence, and health professionals must ensure that this is allowed through the support they provide.
Informative intervention skills require the physiotherapist to provide information and knowledge to the client so that their independent, informed thinking is enhanced. This enables the client to gain understanding and new information that applies to their situation, to interpret and relate to their wants and needs. It is important to effectively convey all information in such a way that the client can make an informed decision about the course of action.
It is important to be able to convey information appropriately to clients at varying age stages. For example, it would be impractical to use complex words to describe a condition to a child who is aged between 6 and 11 who is at Erickson's stage of industry versus inferiority. Feelings of inferiority may be felt if the child does not understand the technical terms. For example, the following roleplay portrays a 10-year-old child who has just had knee surgery being explained a course of rehabilitation by a physiotherapist.
Firstly, the role play will show incorrect use of the informative intervention, and then this will be followed by a demonstration of how informative intervention could be used correctly.
Now, because of your reconstruction of your ACL, I'm recommending that you follow this exercise program. This involves exercises that reproduce a shift of the antagonistic quadriceps and hamstring muscle groups that occur during simultaneous hip, knee, and ankle extension. The strain on your ACL will be reduced because of the positioning of the load through your joint.
Okay.
Now, because of your knee surgery, I'm recommending that you follow this exercise program. This involves exercises that will strengthen the muscles around your knee, on the front and back of your thigh, so that it will help you get back to using your knee normally. These exercises won't put too much strain on your knee because of the position of your body while you use them.
Cool, I can understand that.
In this situation, it would also be useful to demonstrate the exercises so that the child knows how to do them. With older clients, such as someone in their middle adulthood stage, it would be appropriate to use slightly more technical terms that can still be understood, as well as demonstrating the exercises.
According to Rights 6 and 7 of the Code of Health and Disability Service Consumers' Rights, a client has the right to be fully informed and also the right to make an informed decision and give informed consent. Service cannot be provided to a client unless they have given informed consent.
To be an effective communicator in physiotherapy in all health professions, it is vital that one can communicate appropriately with clients at different stages of life. Clients have the right to effective communication, and by using supportive and informative interventions, an awareness of their current situation is created.
These interventions provide a framework for communication and help to form healthy practitioner-client relationships. Thank you for listening to our verbal presentation for psychology and lifespan development.